A trigger finger is a painful condition where the finger gets stuck or locked down. A lot of people come in describing pain in their hand, their finger catching or locking, they can't straighten their finger. A lot of times it's worse in the morning. After we sleep at night, we usually sleep in a fist. In the morning you wake up and the finger will not straighten. The tendon travels through a tunnel, and the tendon inflammation can build up such that it's hard for the tendon to travel in that space, and it can build up enough that the tendon inflammation actually catches or locks along the tendon sheath or the tunnel lining the tendon, such that the finger will get stuck or locked down. This is usually caused by a lot of repetitive motion, repetitive gripping, grasping, or a stretch injury that stretches the tendon. It can create tendinitis or tendon inflammation. Also, things like rheumatoid arthritis, gout, diabetes can predispose somebody to getting the tendinitis. The treatment options for a trigger finger can include simple things like anti-inflammatory medication, resting the finger in a splint or taping the finger so it prevents the finger from bending or flexing, which will rest the tendon so the inflammation can go away. Hot water soaks actually help. It'll limber the finger up, bring more blood flow and the body's natural anti-inflammatories to help fight the inflammation in the finger. In the office, we can provide somebody with a cortisone injection or steroid injection, which is simply designed to remove the inflammation. That works with a fairly high success rate, but it doesn't always cure the problem. A lot of times it's temporary relief, but it's a simple, safe thing to do in the office. The last option is what we call trigger finger release, a relatively minor procedure, something we can do in the office. We do it with a minimally invasive procedure, a small incision less than 1 centimeter. It's done under local only, so you can be awake during the procedure. No sedation is required. And basically, during the time of the procedure, we go down to the tendon sheath, make an incision in the sheath, get access to the tendon, remove the inflammation. The success rate is very high in that the locking mechanism and pain very reliably go away, over a 90% success rate. Just a few small stitches, and you can use your hand the same day as the procedure to write, type, get dressed, feed yourself, use your computer. Heavy lifting is limited for the first 10 days. After 10 days, there's no restrictions. If you are experiencing any of these symptoms and are concerned about this, please contact your medical provider for further care.